This gentleman had a hair transplant done that left many years ago, that left white scar. He has dark hair, and we are doing scalp micropigmentation to camouflage his scar and make it blend better with the surrounding hairs. So what I'm doing is I have pigment. I dip this sterile needle that is pulsating very fast. This is a medical tattooing in sort. And so what I do is I deposit the pigment. I make a little vertical lines to match more like a hair strokes, because the hairs cover, when the hair grow around, they cover the scar in a linear fashion, like a stroke of hair strokes. And this is why I'm making this scalp micropigmentation to look like a little hair strokes. And it's very superficial. This is not like a tattooing, because the scalp contains different anatomical structures. For example, sebaceous glands in a scalp can absorb the pigment differently than the skin will absorb. This is why this is more sophisticated, or it requires special training. Not everyone anybody who is doing tattoo can do scalp micropigmentation. So I created little lines, then I remove the excess of pigment and then see what is remaining. Usually this will scab, and some of this pigment will be reabsorbed. And if you look here, I already did. So if you look at the empty scar, which was before, and now with the scalp micropigmentation, you can't even notice where the scar is. So it will take a few days for this pigment to reabsorb, several weeks to determine whether the pigment stays at the surface or is going to travel into deeper structures. But overall, this gentleman should have a significant improvement after this session of scalp micropigmentation.